You're listening to Columbia's Morning News on 103.5 FM and 560 AM WVOC. Once again, here's Gary David and Christopher Thompson.
14 minutes now past the hour of 8 o'clock. Good to have you along for this Thursday, February 24th. Switching up gears here, we'll keep an eye on the situation in Ukraine, of course. But with the announcement last Friday, it's been nearly a week ago by DHEC, that they would be shutting down their testing sites, and it's just days away here at the end of the month. That because we've got these at-home test kits readily available. You may have gotten one from the government, or maybe you've done like I have in the last week or so, gone by your local convenience store and picked one up. Okay, they're everywhere right now. We're joined by Dr. Carolyn Banister from the University of South Carolina, the director of the Diagnostics Genomics Laboratory. Dr. Banister, good morning. Good to have you with us.
Good morning.
Wanted to talk to you because there are a few questions folks may have about these home tests, and maybe a few things they don't know about them. And you say when it comes to taking a home test that timing is everything. Explain that for us.
It is. So it is pretty tempting when you get your kit delivered to your home to, just go ahead and take it right then, even if you don't have any symptoms. And of course, that's not the optimal time to take it. So the best time to take it would be after you have been exposed to someone who is subsequently found to be positive within about 5 days. If you don't have a positive test at 5 days, then you may want to retest at 7, because you're usually given 2 test kits, just to make sure that you don't have the virus production. You don't want to do it too soon, because too soon your body is not making enough virus to be able to be detected. So,
you find out that, your spouse or somebody you work with is tested positive. Don't run right home and test yourself right away, in other words. So how many?
Exactly.
You mentioned 5 days. Should you wait that long, or maybe 3 days or 4 days, or what's the guidance on that?
It depends on your symptoms. If you have symptoms, go ahead and take the test.
Okay.
Because that's a good indication. But if you don't have any symptoms, then you should wait 5.
Okay, got it. And then you say test again maybe a couple of days later, just to be on the safe side.
Exactly.
Do you have any concerns that maybe when it comes to home tests that maybe we just don't do it the right way? My wife took one about a week ago, and the directions were pretty straightforward. But then again, she's a nurse. So, but do you worry about people who've never done this sort of thing before, maybe messing it up?
I do. Some of the test kits, they're different. There's several different brands that have test kits available. And some of them are a little bit challenging to make sure that you're doing it properly. And of course, just like any of these test kits, when you have a swab that is going in the nose, your sampling has to be done correctly as well as following the directions on the kit. So both of those things can be a little problematic. And I would encourage everyone who has been exposed, who maybe has a negative result on their kit, at-home kit, but then is experiencing symptoms, to go ahead and go in and find one with their primary care doctor.
Okay, gotcha. Yeah, and if it were my wife testing me, she'd have no problems, taking that swab all the way up to my brain. But if I'm doing it myself, maybe not quite so much. And I guess that's
exactly
maybe one of the concerns right there. I got to ask you this. Diagnostic Genomics Laboratory, what is it y'all do over there?
Well, we were established to help detect COVID. So this lab has been in place for 2 years, and we test all the faculty, staff, and students at the university. We've also tested students at the College of Charleston, at Winthrop, at Trident Tech, other institutions that have requested testing from us, and we're able to do a saliva test. So we developed that at the University of South Carolina.
That's right, yeah.
And we're able to test people, and we're still testing.
Do you see, do you agree with those who say we're moving now from pandemic to endemic and it's just time to learn to live with it? Is it I think Dr. Traxler at DHEC said yesterday, we'll never likely see zero COVID cases. It's going to be around. But do you feel like we're kind of shifting gears here in this?
Yes, I do. I'd say that with a little bit of caution because, if we rush back just wholeheartedly, we may have another another round of high positivity.
Right.
But in general, yes, I do agree with that. I think it's going to kind of be like the flu,
Right.
where we have it around every year. And there may be a vaccine similar to the flu or even a combination that we would be able to administer to people to help protect them against any damaging effects of the virus. Doesn't mean that they won't get it. It just means that they won't end up in the hospital.
One final question, Dr. Banister. The Omicron virus, and thankfully it's not been as severe as the other ones, but do we really know when we first started seeing folks around here infected with that thing?
I was able to start detecting it in January. That's the earliest that I was able to detect it.
Oh, okay. So it is moving through pretty quickly then, in other words.
It did. It moved through our population very fast. And the reason is because there was so much virus that it's so good at making copies of itself that the viral load is very high. So you have so much more of a transmission because you have so much more virus from people who are infected.
Right. There you go. Well, many people have said sooner or later it's going to get everybody, and then it'll be gone, I guess. Although you can get reinfected, I know. Well, excellent. So the bottom line here, Dr. Banister, is if you got that at-home test kit, don't open the box up right away and test yourself if you're not feeling something or if you've not been exposed. And even if you have been exposed and don't feel something, you say don't test right away, correct? Wait a few days?
Exactly. Wait about 5 days after your exposure and then test just to make sure.
Great. Dr. Carolyn Banister, the University of South Carolina, Director of the Diagnostic Genomics Laboratory. Thanks for your time this morning. We appreciate it.
Thank you. Bye-bye.
Bye-bye.